Dr. Kneller.
Sure, thanks. Well, I'm right now practicing as a cardiologist and electrophysiologist in Spokane, Washington. You know, I'm a undergraduate from Walla Walla College, did medical school, PhD residency at McGill University in Montreal, and then general cardiology at Columbia, New York, and then subsequently electrophysiology at UCLA. Long road, but we love what we do. It's invigorating, and there's plenty of need out there. And, you know, like you, we like improving the quality of patients' lives, and
Amen.
take a lot of pride in.
Amen. Amen. Now, your topic that you wanted to focus upon is what?
Well, I think a relevant topic that gets overlooked a lot is the topic of atrial fibrillation, a very common cardiac arrhythmia, which, you know, many people in our population, particularly seniors, do suffer from and benefit from more knowledge and awareness of that area. So if with your blessing, I would suggest we have a little word about atrial fibrillation this evening.
Yes.
My guess is there's numerous people in our audience even tonight who have suffered from atrial fibrillation in the past or may be having an episode of atrial fibrillation as we speak.
Okay. How many of you have ever heard of atrial fibrillation? Easy for me to say, fibrillation. How many have ever heard of that? Okay, very good. So what is that? Tell us a little bit more. What is that? The anatomy of that? How does that work? Or I should say, how does the heart not work properly?
Sure. Well, this is a dysrhythmia in the top chamber of your heart, normally where the cardiac impulse comes from. And what happens is a very rapid, disorganized, chaotic rhythm takes place independently of these chambers and overrides the normal mechanism of generating your heartbeat. As a result, the top chambers beat very rapidly, don't contract properly. A consequence of that is that blood can then pool in those chambers, and when blood has the chance to pool, it has the chance to form blood clots, and when it forms blood clots, you can pump those clots then through your main pumping chambers, maybe to your brain, causing strokes. So a rapid, disorganized rhythm in the top chamber of your heart, which allows blood to pool in your heart, allowing clots to form, which can have very significant consequences should they go to inappropriate places.
Okay, okay. So, all right. What is the cause of it? Do we even know? How do you prevent it? How is it precipitated?
Atrial fibrillation is tough, and the number one risk factor at a population level is high blood pressure or hypertension. And what that does is it, over time, will put an increased pressure in the chambers of your heart, cause them to stretch. And as a consequence of that, you can have some fibrosis or scar tissue build up within the cardiac chambers that will then predispose to abnormal rhythms. So as a consequence, you know, because of that pathophysiology, this is something that tends to show up in our senior population a little bit more. 2% of people over 65, 10% over 85 will, you know, have atrial fibrillation, as well as a lot of people much younger than that. But at a population level, it's a disease of the elderly and is a result of just normal age-related changes in your heart with risk factors that can contribute to those, such as ongoing high blood pressure.
Mm-hmm. Okay. So I would imagine this is becoming a more and more common problem that you are dealing with as a cardiologist. Is that true?
This is coming on. This is increasing. You know, 12 million in the United States now, and by 2020, we're predicting 50 million Americans, at least in the United States, will be dealing with atrial fibrillation, and that's a consequence of the population aging. As you know, our population demographics is shifting to, you know, to an older age.
Wow.
So expecting this to become increasingly relevant as time goes on and not to go away anytime quickly.
Okay. All right. So I've got two questions for you then.
Sure.
Treatments. What treatments can you do to, you know, as a cardiologist, what do you do there? And what do you recommend in some cases? And then secondly, what kind of lifestyle habits do you recommend? So deal with that in any order you want to.
Sure. So treatment for atrial fibrillation, you know, if you have a significant burden of atrial fibrillation, meaning you have episodes that last 12 hours, maybe 14 hours, up to 24 hours, anything longer than that, you do have to think about the consequences of blood clots forming, and to protect yourself, we recommend anticoagulation therapy, so blood thinners. And in the past, Coumadin or warfarin was really our only option. Much more recently now, we have blood thinners, which are much easier and much safer to take in point of fact. So that's become interesting in the therapy we can offer people. Once you've protected yourself from the consequences of atrial fibrillation, we can talk about ways to minimize it. And often cardiac meds such as beta blockers are a first-line choice. And after that, working closely with your doctor, you could actually have a trial of certain antiarrhythmic medications which specifically target atrial fibrillation.
Okay.
How in the first place is a great question, because it's obviously something that all of us want to do, and it has a lot to do with our health maintenance that we do over the years as we progress through life and get older. I certainly recommend blood pressure control. If you want to control your blood pressure, the best thing is cardiovascular exercise and moderate salt intake, probably our most important interventions, as well as stress control. And obviously not any illicit drugs, minimizing or eliminating completely caffeine intake, things of this nature.
Okay, so in other words, have a healthy, the heart diet, and
Yes.
some other things that you recommend we do, or you want to expand on that? We just have about 2 minutes. You want to expand on any kind of lifestyle habits you recommend, or?
Cardiovascular exercise. Walking is perfect. A nice brisk walk, to the degree you're able to do it, 30 minutes a day, 5-6 days a week, is perfect. Excellent at lowering blood pressure, preserving cardiovascular health without compromising the rest of your body, such as your joints. People who run a lot often will end up with joint problems later in life, which then limits their ability to exercise altogether. So a cardiovascular exercise routine is the first thing I would prioritize, in conjunction with a vegetarian lifestyle. Nice diversity in fruits and vegetables, in conjunction with a good cardiovascular program, stress reduction, perfect. If we could just get people to do this, my goodness, we'd be well on our way.
Amen, well said. So as a cardiologist, you also put in pacemakers, is that correct? Or you recommend pacemakers at times?
There are times, certainly, when pacemakers are appropriate. I implanted 3 of them today, and all of them were appropriate. When you have symptoms related to slow heart rate, and that can sometimes be in the context of atrial fibrillation. But when you have symptoms related to slow heart rate, pacemaker implantation is certainly a consideration, can be very appropriate.
Wow. All I know is whenever I talk to you, you're at that hospital. What, do you live there?
Because your meetings are too early. I'm just about done. I'm just about done and on my way out.
You better take a break. It's going to take a toll on your heart.
I walk around a lot. It helps.
All right. God bless you. And by the way, happy Sabbath. Everybody say happy Sabbath to our brother there. And we'll look forward to interviewing you a time soon, maybe another time here before we leave British Columbia. But God bless you, Dr. Kneller. I appreciate you joining us.
Thank you, Elder Mark. God bless you too. All the best for your ministry.
God bless you.